So what we have seen yesterday is how it causes mechanism of action. Briefly we can repeat, that is these are the cardioglycosides. They are acting on the sodium potassium ATPases. Because of that they prevent the entry of potassium inside the cell and removal of sodium, and because of that there is accumulation of sodium. Because of the accumulation of sodium, this sodium calcium exchanger pump will not be acting, and because of that calcium will be accumulated. If the calcium is accumulated, then it will act on these ryanodine receptors and at various places, and because of that the calcium from the sarcoplasmic reticulum will be excreted or secreted out, and that will bind with the various actin myosin and other microfilaments, and thereby it will cause the muscle contraction, partial muscle contraction. This is one of the action it is having. Other actions it is having, there are various actions, and because of these actions they are acting. Now it was found, because of that it can reduce the size of heart, and with little energy or with lesser energy heart can function better, and therefore this type of drugs, they are also called as a cardiotonic drug, because it causes increase in the tone of the muscle of the heart, and therefore they are the cardiotonic. So Digitalis and this type of cardioglycosides, they are called as cardiotonic because they improve the tone. They therefore causes contraction of heart, and this partial contraction of heart, that gives muscle more strength, and it can give a powerful contraction. So this is how the major action it is having. Another action it is having is it has got extra cardiac effects. It also inhibits the sodium potassium ATPases pump at other places like many tissues. At lower plasma concentration, they stimulate the vagal efferents, and because of that the vagal stimulation is there. You know what is the vagal? Vagus nerve is a parasympathetic nerve. If not, then please keep your knowledge updated. I repeat every time. So it causes vagal afferent stimulation, and it sensitizes the baroreceptor reflex mechanism. So because of the sensitization, what will happen is rather it sensitizes baroreceptor. So this baroreceptor will feel that there is a very high pressure. Okay, even though blood pressure is normal, but they will sense more pressure, and because of that negatively they will decrease the sympathetic activity. So this is what action is. So it causes increase in the parasympathetic activity because of the stimulation of vagal efferent, and it will cause decrease in the sympathetic activity because of the baroreceptor mediated reflex mechanism. And these two effects are comparatively very good for heart, because parasympathetic wise there is a decrease in the heart rate, is a good thing. Second thing is, because of the sympathetic tone decrease, we have seen that how sympathetic nervous system can be problematic. Earlier during presentation we have seen. So these two things are there, and therefore these are the beneficial effects. At low plasma concentration than the positive inotropic effect. At slightly higher concentration it shows positive inotropic effect. And this causes it can also cause slightly increase in the calcium concentration in the vascular smooth muscle also, and therefore it may cause vasoconstriction. But the thing is, simultaneously its role on the sympathetic nervous system, that is decreasing the sympathetic tone, that compensate the vascular activity, and therefore the direct blood pressure effect is not that much seen. Okay, and only thing is that it causes the mesenteric artery ischemia or occlusion, but it can be a severe adverse effect of the cardioglycoside, because in other arteries because of the sympathetic tone it will be there, and there is a sympathetic tone is variable. At some places it may be higher, at some places it may be lower. So at mesenteric arteries, that sympathetic tone that way is not that properly, and therefore because of that it causes vasoconstriction in the mesenteric artery. Then apart from that, what other action it is having? Apart from the vagotonic, that is increase in the vagal activity or increase in the parasympathetic activity, and sympatholytic activity, that is causes decrease in the sympathetic effect. This causes bradycardia and the atrioventricular prolongation. So it causes negative dromotropic effect, that is the impulse from atria to ventricle will be slower one, it will take comparatively more time than the normal, to what we call it as a negative dromotropic effect, and it can promote the atrial flutter and fibrillation. The fibrillation is explained by the acetylcholine induced shortening of the atrial action potential, and it is further enhanced by the direct this effect described previously, that is on the calcium ion, because calcium will come in or sodium will also be accumulated, therefore it is there. So they are used in the treatment of the permanent atrial fibrillation because they are negative dromotropic effect. So they are important in that atrial fibrillation, they can be used. Then second thing is interaction with the potassium, calcium and magnesium. We know that it blocks the entry of potassium inside, so potassium remains outside the cell, and because of that it can go into blood, from blood it will be excreted, so it causes hypokalemia. Okay, the important thing is whenever there is a calcium, there is a changes in the potassium level, that makes changes in the action of the digitalis. When there is a more potassium is available, that is hyperkalemia, it will reduce the activity of cardiac glycoside, and if there is a hypokalemia, that causes increase the binding affinity of cardioglycoside to the sodium potassium ATPase. Now see important thing, it itself can cause decrease in the potassium, it can cause hypokalemia. Because of hypokalemia, the binding affinity of this cardiac glycoside or digitalis or digoxin will increase. So whenever there is hypokalemia, it will show more effect, and it can cause the digitalis toxicity, because digitalis has got very less therapeutic index. So though in that patient monitoring of monitoring of potassium level is very important, and therefore the drugs like diuretics which are causing loss of potassium or which are causing hypokalemia, example loop diuretics etc., they are not combined with the digitalis at any time, because both will cause decrease in the potassium level. Decrease in the potassium level at such is a dangerous, but it will also cause more danger because it causes more action of digitalis, and it may stop the heart in the contractile situation, because heart will be so contracted that it won't relax. So that will be very dangerous situation which can occur with the digitalis. So this is action. Hypokalemia is a major risk factor for arrhythmogenic effects of the cardiac glycosides. Hypercalcemia also as well as hypomagnesia will favor the overload, calcium overload and spontaneous calcium release events. So this controlling of this serum electrolyte is very, very important. If it is not done properly, then it can lead to more toxicity. So these all ions are to be maintained properly. Potassium should be maintained, it should not be less. Same calcium should not be more, magnesium should not be less. So these all three ions should be maintained properly, then and then only it will show good actions. So adverse effects are there. The therapeutic index is very narrow. I told you it is almost 2. That means what? If somebody with mistake takes 2 doses simultaneously, one tablet was given and somebody says I forgot, and after 1 hour somebody takes another tablet, then it can be toxic, it can lead to death of the person. So that much toxic it can be. Okay, so that is what we call it as a therapeutics index 2. Okay. What are the adverse effects? There are many adverse effects. Most frequent and most serious are the arrhythmias. In the overload of this, they exhibit arrhythmias, around 90% will be shown. Then there are GI symptoms and neurotoxic symptoms because of the changes in the potassium level. So these are various activity. Cardiac toxicity in the healthy person present as extreme bradycardia, atrial fibrillation, AV block, they are there, and it can lead to ventricular arrhythmias are there. Now this is very funny thing and interesting thing with digitalis. This is another thing is there, it can produce ventricular arrhythmias. So this is the adverse effect at higher doses, or we have seen toxicity effects. But at the same time we have seen that it is used in the atrial fibrillation, they are also arrhythmias. So digitalis is a drug basically useful for the treatment of heart failure, but it is one of the very important drug in the atrial arrhythmias, that is atrial fibrillation or flutters, and it is the drug which can cause ventricular tachyarrhythmias or ventricular arrhythmias. So this is what the drug, it was my favorite question almost 12 years, 13 years before, when I was teaching pharmacology to the final year B.Pharm. I asked this question about Digitalis, that Digitalis is used in the treatment of arrhythmia and it causes arrhythmia. Is it correct or wrong? And prove it. So those who were studying it good, they could only answer it. Why? Because yes, it is causing arrhythmia, but it is ventricular arrhythmia, and it is used in the treatment of arrhythmia, that is, it is used in the treatment of atrial arrhythmia. So this is very, very important, very specific about Digitalis, and this type of things rarely occur, that same thing is there that is used and that can cause same adverse effect. So these are there. There are some other effects also which are there. Then therapy, normally once the Digitalis treatment or cardiac access treatment drop, then there is there, but if it is too much problem, we have seen that it is the effect are there, the bradycardia and all actions are there, AV block or all they are there. For that, since it is causing vagal stimulation, we can give anti-vagal drug, or that is sympatholytic agents to make it. And for the tachycardic ventricular arrhythmias and hypokalemia, we can give potassium infusion. And very high potassium can aggravate AV conduction defects. Effective antidote digoxin toxicity is anti-digitoxin immunotherapy. These are the antibodies which are against Digitalis, and they can be given if it is too much. So this is how Digitalis is there. Digitalis, as I told you, have various uses apart from this heart failure, and it is used in very extreme situations. Then next is the treatment principle, heart rate reduction. We have seen yesterday that how the heart rate can be reduced. Example of that was ivabradine. We have seen about it, the mechanism of it. Then drug treatment for acutely decompensated heart. We have seen various vasodilators, combination of hydralazine and nitrates. Yesterday we have seen, and we have seen that they are the best agents for that. Then one more treatment is there, that is nesiritide, that is a recombinant human brain natriuretic peptide. It will dilate the arterial and venous blood vessels. It stimulates the membrane bound guanyl cyclase. It produces more cyclic GMP, and it decreases the preload and afterload. And this is natriuretic peptides, they are found to be good. If you remember yesterday, we have seen about it, how natriuretic peptides are important, how they are against the angiotensin activities, and how the fine balance is made with the combination of angiotensin inhibitor like this various prils, various sartan, candesartan, etc. And along with that was the neprilysin inhibitor. So yesterday we have seen that kind of treatment. Then various positive inotropic effect, I told about it, dopamine, epinephrine, norepinephrine, all these you have studied. And dopamine is also acting through the beta 1 effects, and this is how these drugs are acting. Then there are some new drugs are in the pipeline. These are called as a myofilament calcium sensitizers. Example of these are Levos, Lemdan, then Pumobendan. These sensitizers are approved for short-term treatment. They are for the acutely decompensated heart failure. This increases the sensitivity of contractile myofilaments to the calcium by binding and inducing a conformational change in the thin filament regulatory protein component C, troponin C, and this causes increased force for a given calcium. Means even small whatsoever amount of calcium which was available, that will bring out more forceful contraction. This is how, and without increasing the calcium concentration, this is there. They may also having action like phosphodiesterase inhibition. We have seen example of this milrinone recently. So similar action it can be showing, and because of that it can be further, they can be inhibiting the production of pro-inflammatory cytokines and opening of the ATP dependent potassium channels. So these are various effects they are having. Other drugs which are used in the heart failure, they are example are the vasopressin receptor antagonists like toloptan is used, which is particularly treatment of hyponatremia, a common and difficult to treat complication in the decompensated heart failure. So these are the new drugs, and there are various treatment which are there. So combinations are there, many combinations are available. So these are various drugs which are there. See, these are the drugs which are working. We have seen about milrinone, and it is not that successful. It has been found to be having increase in the mortality, and therefore this drug is stopped. Then pumobendan, just now we have seen it trend, it is not exactly curable, it may cause increase in the mortalities, and these are various drugs which are there. Most of these are causing increase in the mortality, although they theoretically found to be initially found benefit, but it is there. And then there are many such agents which are there, which can be there, but they have found to be having not much beneficial, and therefore they are not there. So theoretically, or as a pharmacologist, you may feel that they are useful, but as therapeutically they do not prove very useful. So this is how the things are going on, and there are many things are going on. This table will show you about various drugs which we have discussed. So these are all ACE inhibitors which are being used in the treatment of heart failure. They are also used in hypertension and other conditions, and they are the first choice. They are only having a biggest problem is a cough, which is there around 5 to 10% of the patient. They can cause this all thing about them we have studied during hypertension, that they reduce blood pressure, they can cause postural hypertension is one of the problem, and it is contraindicated in the patient with the renal artery stenosis, and renal function is there, they are not used. Then there are another one, fosinopril, trandolapril, perindopril, and again they are almost same as the previous prils. Then ARBs are there, that is angiotensin receptor blockers, candesartan, then iprosartan, irbesartan, losartan, olmesartan, telmisartan, valsartan. So there are so many sartan, and out of that again they are used in hypertension, heart failure, and diabetic nephropathy. They are similar ACE inhibitor, and the only benefit is that they won't cough any cough there. Then they can use in the combination with the ACE can cause more harm than the benefit, so they are never combined. We have seen earlier that at least within the 30 days of ACE use, it should not be used. Then beta blockers like bisoprolol, carvedilol, metoprolol, nebivolol can be used. They are used in all cases. And I told you again, it was my favorite question when I was teaching pharmacology, that beta blocker should be used in heart failure or not. So initially it is used, I told you it is slowly used. It is first choice in the treatment of heart failure, and it has to be started in low doses, and slowly the dose has to be increased, and continuous monitoring is there, and if it is found that it is not beneficial, then it can be stopped. Then other drugs which are there, that is mineralocorticoid receptor antagonist, which I told you this is only drug, or the particularly spironolactone, these are the diuretic in nature, and they are used with the Digitalis. They can be, because they are potassium sparing one. Okay, they are first choice in the treating symptomatic heart failure. They can be used in low doses. Their side effects will be more in the hyperkalemia. So they are causing hyperkalemia, and the Digitalis is causing hypokalemia. So you can combine them. Spironolactone can cause painful breast swelling and impotence in men. dysmenorrhea in women because it is acting on the aldosterone, and they have somewhat similarity with the sex hormone, and therefore it can show some effects on that. Then the combination we studied about, that is sacubitril and valsartan, we call them as a ARNI. So this was ARNI, and we have seen the benefits, and the thiazides. So these are how various drugs are effective. Then other are diuretics, various diuretics, we call them as loop diuretics, furosemide, brimetadine and torresamide. These are various agents. They are also good, but they have got problem of hypokalemia and arrhythmia when combined with other drugs. Then isosorbide dinitrate hydrolyzine, this combination we have seen, and it is found to be better. There are few adverse effects. These are all you have studied in hypertension. Positive inotropic agent digoxin, digitoxin, just now we have finished it. Digitalis, how these are, or we call them as a cardiac glycosides. So when we were studying, we were believed that, or we were taught that they are the only or the best drug for heart failure, and now there are changes, or in therapeutics you will see that they are the last choice. They are not the first choice in the treatment of heart failure. So what is the treatment? We have seen the first choice is a beta blocker. When we were studying, we were taught that beta blockers are totally contraindicated, because beta blocker will cause decrease in the heart rate, decrease in the force of contraction, and then it can be a problem. So see, this is how the science changes. So these are the agents. They are not the first choice. They can exert benefit in the heart failure and atrial fibrillation. It has got very low therapeutic index. I told you 2 is almost minimum therapeutic index which is available, or which can be used. Beyond otherwise it should be, as if it is big then it should be better, but 2 means almost very dangerous one. Then other drug is ivabradine, which causes decrease in the heart rate. It is also not the first choice. Then nitroglycerin, sodium prosides, these are the various vasodilators given by intravenous route, and they can be given in acute congestion because they decrease preload and afterload. They release the nitric oxide. We have studied both of these drugs under hypertension also, and angina also. Then nesiritide is recombinant human brain natriuretic peptide. It stimulates the membrane bound guanyl cyclase. It may increase cardiac output while decreasing the preload and afterload. The therapeutic benefits are not sure, but it is believed that natriuretic peptides are comparatively very useful, but still under study it is. Then other intravenous positive inotropes, these are all acting on beta 1 receptors like dobutamine, dopamine, epinephrine, norepinephrine. These all are the beta receptor agonist, and these are the last option in the patient with the systolic blood pressure going less than 85 millimeter of mercury. That means the heart is not pumping enough blood. So increase in the cardiac energy consumption, there is a risk of arrhythmia. There are many adverse effects, but this is the last resort. Okay. Dobutamine causes less tachycardia than epinephrine, and it is less afterload, and it there. Then the role of low dose dopamine is not that clear. Then other drugs are milrinone. Just now we have seen it has been increasing mortality, but theoretically they are available. That is enoximone, milrinone. They are inhibitors of phosphodiesterase enzyme. They increases the cyclic AMP, they increases the cardiac output, dilate blood pressure, may be used in the patient on the beta blockers and with high peripheral and pulmonary arterial resistance. The risks are not clear and may cause. And then levosimendan is also a drug which is combined with the calcium sensitizer, troponin binding and PDA3 inhibitor. So it sensitizes the calcium, and so less calcium will able to do it. It increases the cardiac output, decreases the vascular resistance, and advantages over catecholamines or simple PD inhibitors are there. It is not sure. So this is how various drugs are there which are used in what we call it as a heart failure. So here we finish the drugs acting on heart failure. If you have any difficulties, please let me know. go through this. There are only two important topics I think remaining, that is in cardiovascular, that is arrhythmias. Along with arrhythmia, the topic is electrical conduction in the heart, that is the physiology you should treat. And second thing is, what is remaining in that is drugs useful in the